CPR, cardiopulmonary resuscitation, is an emergency life-saving technique performed to revive a person whose heart has stopped beating or who is not breathing effectively. CPR helps to maintain blood circulation and provide oxygen to vital organs until advanced medical help arrives. Here's a general overview of the steps involved in performing CPR.
1. Assess the situation. Check the person's responsiveness and ensure the scene is safe for you to approach. 2. Call for help. If the person is unresponsive and not breathing or only gasping, shout for help or ask someone nearby to call emergency services, example, 911, while you start CPR. 3. Positioning. Place the person on their back on a firm surface. Ensure their airway is clear of any obstructions. 4. Chest compressions. Kneel beside the person's chest. Place the heel of one hand on the center of their chest, between the nipples. Place your other hand on top of the first hand, interlocking your fingers. Keep your elbows straight and position your shoulders directly over your hands. Push hard and fast, compressing the chest at least 2 inches, 5 centimeters, deep and at a rate of about 100 to 120 compressions per minute. Allow the chest to recoil fully after each compression. 5. Rescue breaths. Open the person's airway by tilting their head back and lifting the chin. Pinch the person's nose shut and place your mouth tightly over theirs to create a seal. Give 2 rescue breaths, each lasting about 1 second, while watching for the chest to rise. If the chest doesn't rise, reposition the head and try again. 6. Continue cycles of compressions and breaths. Perform 30 chest compressions followed by 2 rescue breaths. Repeat these cycles until professional help arrives or the person shows signs of life. It's important to note that CPR techniques may slightly vary depending on the guidelines set by local authorities or medical organizations in your region. Therefore, it's advisable to undergo proper CPR training and certification to learn and practice the most up-to-date techniques. Remember, the steps above are a general overview, and it's crucial to seek professional training to ensure you have the skills and confidence to perform CPR correctly. Don't forget to like, subscribe, and hit that notification bell to stay updated. Thanks for watching.